Hello, my name is Tanya. I'm going to be doing the head to toe skills assessment video. I am wearing the proper school uniform color along with the name badge. This is going to be my patient for today. He's going to go ahead and give consent.
My name is Gerson and I consent to recording this video.
Okay, so I'm going to go ahead and introduce myself to the patient. We're going to knock on the door. We're going to close the door behind us. We're going to perform hand hygiene and we're going to introduce ourselves. Hi, my name is Tanya. I'm going to be your nurse today. Can I please verify your name and your date of birth?
Yes, Gerson Santizo, 11/13/82.
Thank you. So the patient verbalizes the correct information that's on the ID wristband. So before I continue, I just want to let you know that the doctor did go ahead and place an order for a head to toe assessment post surgery. So we are going to be assessing from the top of the head all the way down to your toes. Are you in any pain at this time?
No pain.
Okay, and prior to us starting our assessment, we've already done the vital signs. The patient's blood pressure is 120/60. His heart rate is 70 beats per minute. His respiration is 16. His temperature is 98 degrees. And his oxygenation is 98% at room air. He is able to speak, do eye contact, verbalize. So we will give him a Glasgow Coma scale of 15. Patient denies any pain at this time. Okay, so I'm gonna go ahead and start my head to toe assessment for you. We're gonna start off with checking your head, okay? We're gonna go ahead and put our gloves on prior to touching the patient. Okay, I'm gonna go ahead and palpate your head. Any pain?
No pain.
So upon palpation of the head, there is no masses, lesions, no skin breakdown, there is no infestation, and there is no patches of balding. Okay, now we're gonna go ahead and check your eyes. So what I'm gonna do is I'm gonna have you look at the tip of my ear, and then I'm gonna shine a light on your eye, okay? So just focus on the tip of my ear. Thank you. Now I'm gonna go ahead and look at your eyes, look at me. Okay, I'm gonna pull your eyelids down. Perfect. Okay, so the patient has pupil that are equal, round, reactive to light, and accommodating. The sclera is white, no yellowing noted, and the conjunctiva is pink, moist, no redness, no discharge noted from the eyes. All right, and now I'm gonna have you follow this, the tip of the Q-tip without moving your head, just with your eyes, okay? Perfect. So patient is able to follow the tip of the Q-tip without moving his head. All right, now we're gonna go ahead and move down to your nose. So I'm gonna go ahead and palpate your nose. Any pain?
No pain.
Okay. So we're gonna look inside your nose. I'm gonna have you look up, hyperextend your neck. Thank you. All right. So the patient's nose is symmetrical to the face. There is no septum deviation noted. There is no obstructions noted, and the inside of the nose is pink, moist, no redness or lesions noted. Now we're gonna do the airflow test. So I'm gonna have you occlude one nostril and breathe in and out for me. Go ahead and do it on the other side. Perfect. So nares are patent. There is no obstruction in the airflow. Airflow is good. Now we're gonna go ahead and check your ears. So I'm gonna look inside your ear. Any pain or discomfort in your ears?
Nothing.
Thank you. So the ears do not appear to have any type of clear discharge. The eardrum or the tympanic membrane is gray, translucent, and shiny bilaterally. Patient doesn't complain of any pain in the ear at this time. We're gonna go ahead and do a whisper test as well. So what I'm gonna do is we're gonna do a whisper test. I'm gonna cover one ear. I'm gonna whisper something. You're gonna verbalize it back to me, okay?
Okay. 1, 2.
Perfect. So patient is able to hear appropriately. Now we're gonna go ahead and check his mouth. Just by looking at the lips, there are no cracks or lesions. There is no discoloration, such as cyanosis on the lips. All right, now I'm gonna have you open up your mouth nice and wide. Say ah. tongue. Thank you. Alright, so the patient's oral mucosa is pink and moist. There is no lesions or sores noted inside or outside of the mouth or on the tongue. His teeth are intact. He does not have dentures. The tonsils are pink. There's no swelling or exudate noticed on the tonsils. Now we're gonna go ahead and palpate the patient's sinuses. So I'm gonna go ahead and touch over certain areas of your face. If you feel any pain, just let me know. Any pain?
No pain.
Any pain?
Mm-mm.
Okay, so patient denies any pain in the sinuses, no tenderness noted. We're gonna go ahead and check the patient's trach. Okay, so I'm gonna go ahead and touch your trach. Let me know if you have any pain. Any pain?
No pain.
Okay, so the patient's trach is midline. There is no masses noted, no deviation noted. Now I'm gonna go ahead and palpate around your neck. Let me know if you have any pain, okay?
No pain.
Back here,
No pain.
here,
No pain.
here. Any pain?
No.
Okay, so the patient denies any pain at this time. Lymph nodes do not appear to be swollen. There are no masses noted in the lymph nodes either. Since we are on the head portion, we're gonna go ahead and check for the temporal pulses and the carotid pulses. Okay, so I'm gonna go ahead and touch here. Okay. Okay, so both temporal and carotid pulses are 2+ bilaterally. They are normal. We're gonna go ahead and move down to the patient's lungs. So now I'm gonna go ahead and listen to your lungs.
Okay.
Any problems breathing?
No.
Have you had any recent coughing?
No.
Okay. And I'm gonna have you breathe deep in and out, okay?
Mm-hmm.
Go ahead. Again. 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 Go ahead and sit forward. We're gonna do the same thing in the back, okay? Go ahead. Okay, you can go ahead and sit back. So there is no labored breathing notice. The patient's rise and fall is normal. Chest expansion is symmetrical. Lung sounds all sound clear. Patient denies any cough. And there is no adventitious breath sounds noted upon auscultation. Now we're gonna go ahead and move to the cardiovascular portion. So I'm gonna go ahead and listen to your heart, okay? And for this, you're gonna breathe normal. Okay, so S1 and S2 are heard upon auscultation. There is no gallops or murmurs noted. The heart sounds good. Now we're gonna go ahead and check the pulses. I'm gonna check the brachial and the radial, so I'm gonna touch here. Here. Now we're gonna move down. We're gonna check the pulses down here. Okay, so the patient's brachial, radial, dorsalis, pedis, and are all bounding. They're normal, 2+ bounding bilaterally. Now we're gonna go ahead and check for capillary refill, so if I can borrow your hands. Let me see this nail. And we're gonna do the toes. So patient's capillary refill is less than 3 seconds bilaterally on the hands and the feet. And since we're already here, the patient's nails has no ridges, there are no cracks, and no indentations or dents noted on the nails. Now we're gonna move down to the abdomen. When was your last bowel movement?
Today.
Today. Have you had any issues going to the restroom?
No issues.
Have you had any bladder issues?
No. Bladder.
Any problems having a full stream? Any discharge? Okay, so I'm gonna go ahead and have you lay down for me. Alright, so just on inspection, the patient does not have distended abdomen, no masses noted. So we're gonna go ahead and auscultate now all 4 regions of the abdomen. Alright, I'm gonna go ahead and listen, okay? I'm gonna go ahead and palpate. You let me know if you have any pain. Any pain?
No.
Alright, you can go ahead and sit up for me. Okay, so there was normal bowel sounds on all 4 quadrants for the patient. Upon palpation, there was no masses or hernias felt or noted. Now we're going to move down to his musculoskeletal. So what I'm gonna do is we're gonna check for range of motion. So I'm gonna have you, we're gonna start with your neck. So I'm gonna have you look up and down, and side to side. Any pain?
No pain.
Okay, patient has full range of motion on the neck. Let me have you put your arms out, and I'm gonna have you circle, do a circle. Any pain?
No pain.
Okay, patient has full range of motions on the arms. Let me have you sit with your feet dangling. Alright, and can you do circles with your ankles? Okay, patient has full range of motion in the ankles. Let me have you stand up. And now I'm gonna have you touch your toes. Alright, now go ahead and get up, stand up. And I'm gonna push you, just don't let me push you, okay? Alright, perfect. So full range of motion in the on the back. Let me have you sit down again. We're gonna check your senses. So this is gonna be the soft part, okay? And this is gonna be sharp. So I'm gonna have you close your eyes and you tell me what you feel, okay?
Soft. Sharp. Soft. Soft. Sharp. Sharp. Soft. Sharp.
Alright, so patient has, all the patient senses are intact. Now I'm gonna have you squeeze my fingers. Alright, perfect. Now go ahead and put your arms like this. I'm gonna push against you. I'm gonna have you resist, okay? Now resist, okay? Go ahead and stretch your legs out. And same thing, try to resist, okay? Perfect. Alright, so I'm gonna have you sit back on the, go ahead and sit back on the bed. Alright, now let me check your hands. Any pain on your fingers?
No pain.
Any pain on your toes?
No pain.
Okay. Any pain on your knees?
No pain.
Elbows?
No pain.
Shoulders?
No pain.
Okay, so patient denies any pain in the joints. The joints of the hands and the feet look normal. He did show a 5+ strength on bilateral arms and legs. And we are also gonna go ahead and do the knee reflexes. So I'm sorry, I'm gonna have you put your feet. Thank you. So what I'm gonna do is I'm gonna do a light tap, okay? On both your knees. Ready? Okay. Perfect, thank you. Go ahead and sit back so the patient's reflexes are normal. And I know I asked you this in the beginning, but can you give me your full name?
Gerson Santizo.
And what's today's date?
7/19/26.
And who's the President of the United States?
Donald Trump.
Okay, so the patient is alert and oriented ×3. I'm gonna have you do just a couple more exercises with me. So let me have you get up off
Yeah.
the bed. Alright, and I'm gonna have you walk straight.
Okay.
Come on back. Perfect. Now looking that way, I'm gonna have you rub your, or run your heel on the opposite shin. Perfect, same on the other side. Alright, go ahead and take a seat. So the patient is alert and oriented ×3. His gait is normal. He has good balance. Center of gravity is normal. He has good coordination and his reflexes are intact. Lastly, we're gonna be checking the skin. So let me just take a look at your skin. Any irregular bruising that you've noted? Any skin breakdown?
Nothing.
Alright, we're gonna look at the bony prominences, so right under the heels, behind the elbow. Now let me have you move forward, we'll look at the coccyx as well. Okay, so there is no skin breakdown on any of the bony prominences, the skin is intact, no abnormal bruising or lesions noted. And we're gonna go ahead and give some patient education. So the patient is post-op following knee surgery for a LCL tear. So just to let you know, since there are incisions on your knees, things that you wanna look out for is redness, swelling, any drainage, abnormal drainage coming out of it, or a foul odor. Those are all signs of infection. So just try to keep the incisions dry. Try not to soak in a bathtub or go to a pool. The doctor has gone ahead and ordered pain medication for you, so you can take that medication as needed, as prescribed by your doctor. And just please make sure you don't have a fever of over 101. If you do, give us a call so we can see you immediately. And just attend to your follow-up once you've been discharged, okay? And do you have any questions for me at this time?
No questions.
Okay, so then we would go ahead and remove our gloves at this time. We would perform hand hygiene. We'll go ahead and document our full assessment and findings and our patient teaching. And that concludes the video for our head to toe assessment. Thank you.